Good afternoon, and thank you once again for joining us today. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 1,636. That represents 7% of the total number of tests and takes the total number of confirmed cases in Scotland to 168,219. 510 of today's new cases were in Greater Glasgow and Clyde, 328 in Lanarkshire and 182 in Lothian. The remaining cases were spread across 10 other health board areas. I can also confirm that by 8:30 this morning, 334,871 people had received their first dose of the vaccine. We remain on track to give a first dose of the vaccine to all people who are over 70 by the middle of February. And we are launching a new campaign today, the Roll Up Your Sleeves campaign, which is designed to maximise uptake of the vaccine by encouraging everyone to get their first dose as soon as they are contacted and asked to do so. To return to the daily figures, 2,004 people are currently in hospital. That is one more than yesterday. 161 people are in intensive care, which is an increase of 5 from yesterday. And I regret to say that 89 additional deaths have been registered in the last 24 hours of a patient who first tested positive over the previous 28 days. That means that the total number of deaths under this daily measurement is now 5,468. That total is a stark reminder once again of the grief and the heartbreak that the virus continues to cause, and I want to extend my sympathies and condolences to all those who have lost a loved one during this pandemic. I'm joined today by Professor Jason Leitch, the National Clinical Director, who will help me to answer questions in a few moments. Before then, I have 3 points that I want to briefly update you on. The first is that the Scottish Government will publish later on today the latest estimate for the R number in Scotland. That will show that the R number may now be around 1 and has probably fallen during the last week. That assessment provides some further evidence that our measures are, at the very least, helping to stabilise case numbers. However, as the numbers I have just read out demonstrate, they remain concerningly high. The second point I want to raise is about support for childminders, who are such a vital and valued part of our childcare sector. Many childminders have been affected by the pandemic and by the restrictions placed upon them, and some have expressed concern about the future sustainability of their businesses. The Scottish Government is today publishing a series of actions that will support the childminding sector in the future. And we're also making more immediate help available. We have set aside up to £1 million to support childminders who have been financially affected by the pandemic. We're currently working with the Scottish Childminding Association to finalise details of the support scheme, so further information on how to apply will be published soon. However, the scheme will enable childminders to apply for grants of up to £1,000 each. Childminders play a hugely important role, and the work they do is, I know, valued and appreciated by families across the country. This new fund will provide them with some of the support they need in order to continue to carry out that role. That's something that will be increasingly important as we emerge from lockdown and as more parents return to work. The final issue I want to cover relates to testing. Walk-in test centres are a valuable part of our wider testing programme, since they help to increase the accessibility of testing, especially for people who do not have access to a car. I'm therefore pleased that 3 new walk-in test centres opened this week. A walk-in centre opened in Paisley at Bridge Street Car Park on Tuesday, and sites open in Dunfermline and Glenrothes later on today. All 3 sites are in or near the centre of each of these towns. Each of the new centres will be able to carry out up to 300 tests a day, and they increase the total number of walk-in centres in Scotland to 28. Together with the other strands of Scotland's testing programme, therefore, they will help to increase the accessibility and the effectiveness of testing. We are working with NHS National Services Scotland, local authorities and health boards to establish more local testing centres in the weeks to come. Testing is a very important way of keeping the virus under control. We have also in the last week tightened travel restrictions, and we are of course accelerating the vaccination programme. However, at the moment, while case numbers remain so high, our lockdown restrictions continue to be vital. They are the single most important way in which we can reduce case numbers and ease some of the pressure on our health and social care services. I will finish therefore by reminding you once again of our key rules and guidelines. Our main rule at the moment continues to be a very simple one: stay at home. In any level 4 area, which is almost all of Scotland, including all of the mainland, you must only leave the house for essential purposes, such as caring responsibilities, essential shopping and exercise. So please do that, and please stick to the spirit of the rules as well as to the letter. Don't think about doing as much as you can get away with. Think instead about how you can reduce the number of times you go out and about. If you meet up with someone outdoors, you can only meet up with one other person from one other household. You must work from home if you possibly can, and employers have a legal duty to support people to work from home. And on any occasion when you do leave the house, please remember facts. Wear face coverings when you're doing essential shopping, avoid anywhere that's busy, clean hands and surfaces, use 2-metre distancing if you're talking to someone from another household, and self-isolate and book a test if you have any symptoms. Above all else though, please stay at home as much as is possible. Staying at home is the best way of keeping ourselves, our loved ones and our communities safe, and of keeping the virus under control while the vaccination programme continues. So please stay at home, protect the National Health Service and save lives. Thank you once again to everyone who is doing exactly that. And we'll now move on to take questions at this afternoon's briefing. So can I first of all ask Hayley Miller from the BBC to ask the first question?
Thank you very much, Deputy First Minister. My question is really around the supply of vaccines. The BMA are saying that the target for vaccinating the over 80s can be met if you can make the supply of vaccines to GPs more reliable. Do you agree? And if so, how are you going to do that? And in a related question from a GP on Lunchtime Live today, who asks the Scottish Government to allow GPs to order directly their supply, which they say would ensure that all GPs get the supply that each practice needs. Can you change the ordering process, the procurement process, to make it run more efficiently?
Thanks very much, Hayley. I'll say a few comments first of all, and I'll invite Professor Leitch to add on a few other comments as well. The first point that I want to make is that the government is very confident on the basis of the existing commitments to supply that we have, that the over 80s will be able to be vaccinated within the timescale that we set of the first week in February. And very good progress has been made on the delivery of the vaccine, with significant increases in the progress of the vaccine programme throughout the country. And we are confident that, providing the supplies come through to us, we have the mechanisms in place and the supply routes in place to make sure all over 80s can be vaccinated by the end of the first week in February. Now, in relation to the supply routes, the Chief Pharmaceutical Officer of the Scottish Government has been discussing these issues with the BMA and with other interested parties in the health service to make sure that we address any issues that are there about the distribution of the vaccine. We'll continue to talk to GPs about those routes. We're confident in the existing arrangements that we have in place, but we are, of course, very happy to engage in further discussion to advance any of these questions to make sure that the supply of vaccine is as smooth and as effective as it possibly can be in the distribution to localities in the country where the overwhelming majority of the vaccination of over 80s will take place. Jason.
Thank you, Deputy First Minister. You've covered it. The reality is that we simply do not have as much vaccine as we have asthma inhalers or even flu vaccine during the flu vaccination period. So you have to have a level of control to that distribution. Otherwise, it would be uneven throughout the country and we wouldn't be able to manage a practice that has 2,000 over 80s and a practice that has 70 over 80s. So every country has a layer of management that does that. We've used health boards. England has used what they call clinical commissioning groups, large networks of GPs to manage that distribution in as fair a way as we can. But let's be clear, we're all headed to the same place. We're all headed to all over 80s being vaccinated at the end of January, beginning of February, just exactly like the health and social care workers and those in care homes. But if the BMA have ideas about how to improve that and make it better, of course we will listen to them. They're on the committees that help us make these choices.
Okay. We'll now move on to Ross Govins of STV. Ross.
Afternoon, Deputy First Minister. Has any further consideration been given to prioritise key workers such as teachers and police officers in the next stage of the vaccination rollout? And you said there you're launching a campaign to encourage people to take the vaccine, but some surveys suggest serious concerns about the take-up in some ethnic groups. What needs to be done to encourage more people to take the vaccine?
Thanks very much, Ross. We're obviously following very carefully the advice of the Joint Committee on Vaccination and Immunisation about the prioritisation of who should get the vaccine first and in what order. And the Joint Committee is very clear that you should vaccinate on the basis of the greatest exposure to risk of serious illness and mortality through the virus. So that's what's led us to take the patient time that's required to work through all of the care homes, and we've now vaccinated in our care homes well in excess of 90% of care home residents to provide the most vulnerable and the most exposed to the virus the greatest degree of protection at the earliest possible opportunity. Now, obviously, in the course of the distribution of the virus over the priority groups that have been identified by the Joint Committee, there will be a range of different occupational groups that will be included within that, because there will be teachers and police officers who will be in that in the age groups and they have the clinical vulnerability that enable them to have the vaccination as part of the first phase of the programme. There are obviously further discussions going on about what the prioritisation should be thereafter. Those discussions are still underway within government and with all of our relevant stakeholders, because it's important that we concentrate first of all on ensuring the successful delivery of the vaccination programme, which I think is happening as we speak, and then also that we consider what should be the degree of prioritisation that follows in that respect. And we will, of course, take further advice from the Joint Committee on Vaccination and Immunisation. Now, in relation to your point on vaccine take-up, obviously the campaign that we're launching today is a really important one, because it's designed to engage the public with good information and to motivate members of the public to respond promptly and swiftly to being invited to receive the vaccine and to acquire that level of protection. Now, where there are specific groups in our society where there may be a reluctance for whatever reason, we have to reflect that in our messaging and in our campaigns, and we will, of course, engage constructively with all relevant groupings within society to make sure that we maximise take-up, because maximising take-up will be the most effective way of dealing with the virus, by having that extensive population-wide vaccination programme being successful in every respect. Okay, can we move on to Peter McMahon of ITV?
Thank you very much, Deputy First Minister. Deputy First Minister, Jeff Ace, who's the Chief Executive of NHS Dumfries and Galloway, has spoken over the last couple of days of the pressure that's on the health service in the south of Scotland. 70 cases of COVID at one point, he said, had a huge impact, incredibly difficult to sustain the services that they're providing at the moment. So are you confident that the hospital services in the south of Scotland can not only cope with COVID, but also cope with the winter pressures that are already on them?
Well, this is a very serious issue, and I'll invite Jason Leitch to say a little bit in addition to what I say. But the comments and reflections from Jeff Ace, the Chief Executive of the Dumfries and Galloway Health Board, are not in any way a surprise to me, and they are also wise and accurate comments on the challenges that the National Health Service face. A number of broadcasters, and you've just done it again here, Peter, have had an insight into the challenges that our hospitals are facing. And I think anyone observing those pieces of broadcast footage and that commentary cannot in any way miss the two obvious points that I think that come out of that coverage. One is of the enormous pressure that the health service is under at the present moment by a combination of COVID and general winter pressures that the health service always faces. But secondly, the degree of additional burden that staff are carrying as a consequence of the fact that this wave of COVID is coming on top of a period previously of enormous intense pressure. Now, we've recognised the pressures that Jeff Ace has talked about by moving to the very severe levels of restrictions that we have put in place, because without that, I think it would have been inconceivable that the health service would have been able to cope with the volume of demand that would have presented itself had we not taken the steps that we have taken. Now, the Dumfries and Galloway example, I think, is a very good one, because it wasn't so long ago that ministers were agreeing for Dumfries and Galloway to have restrictions relaxed for justifiable evidential reasons about the fact that there were very few cases in the Dumfries and Galloway area, only to find ourselves with the onset of the new variant in a situation where cases in Dumfries and Galloway were frankly galloping away from us at an alarming pace, resulting in the type of congestion that Jeff Ace has talked about within the hospitals in Dumfries and Galloway. So that case illustrates the pressure on the National Health Service, but also the necessity for the restrictions that we have put in place, and the plea that I make to members of the public to follow all of the guidance, because if we follow the guidance, we reduce the number of cases and we'll reduce the number of people presenting in our hospitals. Now, lastly, Peter, you asked me, am I confident that the health service can manage all of this? I am confident that our health and social care professionals are absolutely devoted every minute of the day to trying to address this challenge and working to do so. But I also have to acknowledge that they are tired, they are burdened, and there will also be challenges on the capacity within the health service. Now, in some parts of the country, we're having to move patients from health board area to health board area simply because capacity is under such pressure. And the circumstances that you've recounted to me about Dumfries and Galloway are not unique. They are pretty much the story in the whole of Scotland. So that's why ministers stand here, the First Minister and I stand here, and the Health Secretary stands here and make the plea for members of the public to follow the rules, to reduce the number of cases, and to relieve the pressure on the National Health Service. Jason, would you
I've said this a few times, Peter. I'm afraid both Dumfries and Galloway and Scottish Borders give us, unfortunately, very good examples of how this virus works. And you are right. The hospitals in both of your areas where you broadcast are under pressure. The fundamental answer to your question is yes, the National Health Service can manage. But it will manage because it's on an emergency footing and having to cancel things it wants to do and move people around the country that it doesn't want to move. So we are in a different phase than if we didn't have COVID. There are green shoots of hope in Dumfries and Galloway. You still remain with a case rate well above the Scottish average, but it has fallen, and that's testament to the people of Dumfries and Galloway following the rules. Your positivity rate is still 10.2. Your 7-day average is 263. The Scottish average is now 207. So you're still well above average, and that happened quickly, but it is falling. So just as the Deputy First Minister said, the point I would emphasise, apart from not being scared that your health service will be overwhelmed, your health service is available to you if you fall ill. The other thing I would emphasise is it depends on your behaviour. Bringing that number down depends on each and every one of you thinking as you open the door, do I actually have to open it?
Okay, thanks very much, Jason. Can I move to Alan Smith from Bauer Radio? Alan.
Thank you, Deputy First Minister. Just a question in regards to schools and what you consider to be a sufficient notice period between the time you make an announcement of potential school reopening and when they actually reopen. For example, you've said you give parents and teachers as much notice as possible. Is that a week? Is that 2 weeks? And I know we're some time away at the moment, but is there any discussions at this stage regarding the Easter holidays, any potential changes, or are you expecting them to happen as planned? And a question for Professor Jason Leitch as well. NHS Highland is now asking staff and visitors at its sites to wear fluid-resistant surgical masks instead of face coverings in response to the new variant. Do you think this is something that is likely to be replicated elsewhere? And more generally, is there any further consideration being given to changes to the face covering guidance? For example, could we be asked to wear them outdoors, as is the case elsewhere?
Thanks very much, Alan. If I address the issues of schools, first of all, I had a meeting this morning of the Education Recovery Group where we began to explore in further detail the approaches that may well be taken to the resumption of face-to-face learning. What I'd say, before coming on to some of the detail about all of that, is that there is a huge amount of very good work being undertaken by our educators, the length and breadth of the country, to deliver remote learning, and I'm very heartened by the feedback that I'm seeing through the education system about the quality and the extent of the remote learning work that has been put in place to meet the needs of learners during this period of disruption. The Education Recovery Group looked today at some of the early thinking about how we may resume face-to-face learning, and we developed further our thinking around some of the propositions that ministers have set out, that we would be looking at priority groupings to try to resume face-to-face learning. It is much more likely to be a phased learning approach rather than the approach we took in August, where all pupils returned in one go in August. It is much more likely that we will bring back different cohorts of pupils, and we're exploring what might be the groupings that could be brought back within the context of the scientific and clinical advice that is available to us. Now, that scientific and clinical justification doesn't yet exist, nor does the wider context of the suppression of the virus exist to enable a resumption of face-to-face schooling. But I want to get to that point at the earliest possible opportunity. Now, you asked me about the notice period that might be given. Ideally, I would like to give as much notice and as much certainty as possible. Ideally, I would like to give 2 weeks' notice to everybody involved about a return to face-to-face learning. But obviously, we may give shorter notice than that if we believe the opportunity exists for such an approach to be taken. I think that's justifiable in terms of the resumption of face-to-face learning, whereas what we tried to do when you're opening up the system, frankly, it's easier to give shorter notice than when you're closing it down, when you have to perhaps give a bit longer notice, which we gave in this circumstance. So we'll try to give as much notice and as much clarity at the earliest possible opportunity, but it will depend on two factors: the scientific advice that's available to us about the impact of the virus on particular age groups and cohorts of pupils, and it will depend on the general prevalence of coronavirus within our society. And we're obviously looking at that data on a very focused basis to make sure that we take the right judgments that are safe for staff, for pupils, and for families. Jason, NHS Highland.
I haven't seen the specific NHS Highland advice, but the general face covering advice hasn't changed. It's kept under constant review. We've changed it many times as we follow the science. The 4 chief nursing officers of the 4 UK nations are in charge of that infection and prevention control advice. People should wear face coverings, standard face coverings, when they go in and out of indoor environments such as hospitals and care homes, and that remains the advice. Most staff do wear fluid-resistant masks most of the time because they're engaged in a slightly higher risk environment, but the fundamental advice has stayed exactly the same. But if that changes, we'll be first to tell you.
Okay, thanks very much. Jason, we'll now move on to Alan Zazinski of Global Radio. Alan.
Thank you, Deputy First Minister. We've seen reports of people in England being able to get a coronavirus vaccine despite not actually being eligible for one because of an IT loophole. That was from links to the online booking system meant for NHS frontline staff being shared on social media. People being able to click that, gain access to the site, book their jab just by putting in some fairly minor details. I'm just wondering if that's something we should be worried about in Scotland. Have there been any reports of that happening here or something similar happening here? And if so, how widespread is it? And if not, what is being done to prevent people abusing these kind of booking systems in this sort of manner?
I'm not aware of us having any problems of that type, Alan, and the arrangements that we have in place are, of course, driven by the data that we already hold on the health system about the age of individuals. We're fortunate in having a healthcare system that relies upon a unique number for each citizen that's in our country. So we are able to relate that to dates of birth to ensure that eligible groups in relation to their date of birth and their age for eligibility for the virus. Obviously, we know who health and social care workers are because they are employees of the health service and local authorities, and they're invited to come forward for vaccination. So I don't envisage us having any issues of this type. The programme has been worked through in an orderly fashion to make sure that everyone that is within the priority groups are able to be vaccinated in the order suggested to us or recommended to us by the Joint Committee, which of course is based on the most serious amount of scrutiny of the risk that individuals can face from the virus. If we can move on to Greg Fluker of Kingdom FM. Greg.
Thank you, Deputy First Minister. Although case numbers are starting to drop, hospital numbers here in Fife have been rising since early December. At what point might we see the restrictions have an impact on those figures? And secondly, tomorrow is 4 weeks since Christmas. Do you have a sense yet of the true impact of easing of restrictions on Christmas Day?
I think in terms of, there is a very clear relationship, Greg, between the number of cases and the congestion within our hospitals. Going back to the question that Peter McMahon asked me about Dumfries and Galloway, the situation that you raised with me about Fife is essentially a symptom of the same challenge. If we have high prevalence levels, there will be more cases that eventually present in hospital. We know that it takes several weeks ordinarily for a case to move from being identified as positive to then presenting in hospital. What we are finding is that patients are generally spending longer in hospital when they are in for treatment. The treatments are getting better, but they require to be in for longer for those treatments. So, of course, the longer a patient is in hospital, the less space that's available for somebody else to come into hospital. And all of these factors combine to account for the congestion in our hospitals that you've correctly identified in NHS Fife. Now, the flip side of that is also the case. If we have numbers coming down, we will, over time, see a reducing burden on the National Health Service, which is why the government took such strong action to apply the level of restrictions, because we knew if we didn't do that, then we'd run the risk of our health service becoming unsustainable and unable to meet the emergency requirements of members of the public, which is the absolutely core purpose of the National Health Service in extremis. So we will expect, as those numbers come down, to see that pressure on the health service easing, but we have to bear in mind the fact that patients are generally spending longer in hospital when they are being treated for coronavirus. Now, in relation to the point on Christmas, given what I've said about the gestation period for the virus, we think within the case numbers, we have seen the effect of Christmas within the case numbers, and that will largely be presenting itself within our hospitals today. So what we are experiencing and the challenges that we are facing will be a product of the development of cases, that rapid acceleration that we saw in the immediate aftermath of Christmas, between Boxing Day and 10 days later, the situation in the cases per 100,000 in Scotland virtually doubled in that period. So we've seen the effect of that, and hopefully we're now beginning to see that beginning to reduce within the system. But the burden on the health service remains significant. I don't know if you want to add to...
Quickly, perhaps, about Christmas in particular. I think we've now seen first-generation infections from Christmas in the numbers, and now in the hospital and ICU admissions, and unfortunately in the deaths. The challenge here, of course, is second and third generation infections. So if you mix that Christmas, got positive, and then spread it further, and that is our big danger. That's why the restrictions and the safety measures stay in place now. However, the R number news from our data in the last week is encouraging. It would suggest that R has fallen, even with our very high prevalence, which means we can't take our foot off the safety measures. But the R number would suggest that the spread is decelerating. It's very fragile, but is decelerating. And to DFM's point about the hospital admissions, particularly in Fife, you're right, there's a delay. It takes about 2 weeks to end up in hospital, another week in ICU, and then another week, unfortunately, to death. It's not as linear as that. Some are faster, some are slower. But what you're seeing just now in Fife is the effects of infections 3 weeks ago. So 100 and whatever it was today, 1,700, 1,800 cases, that's 170 admissions 2 weeks from now.
Okay, thanks, Jason. Can we move on now to Tom Eden from PA? Tom.
Thank you. Good afternoon to you both. It's really following up from Alan's question about schools and the time given to parents, teachers and pupils before you reopen it to all pupils. England's Education Secretary has said pupils down there will definitely get 2 weeks notice. And I know you said that your intention, but if the opportunity exists, it could be shorter than that. I was wondering what specifically the circumstances would be for you to give less notice than that. Yeah, thanks.
Thanks, Tom. Essentially, the judgment we've got to arrive at is a combination of a number of points. First of all, we have to look at the general prevalence of coronavirus within society, because one of the reasons why we have moved to remote learning is to reduce human interaction within our society to a greater extent by requiring children and young people to stay at home for their education. That requires many parents to stay at home to support them and to work from home. So it reduces human interaction in society in general. So we have to see the pattern of the development of the virus, a reduction in the caseload to give us confidence that we're moving in the right direction. Secondly, we've got to be very mindful of the position that I've just discussed in earlier questions about the capacity of our hospitals. Because if we were to, for example, reopen schools to more pupils, there would be more human interaction, therefore giving rise to the possibility the virus may spread, and that could potentially increase caseload within hospitals. So we've got to be mindful of hospital capacity. And then thirdly, we've got to look in detail at what is the effect of the virus, but particularly the new variant of the virus on children and young people themselves and their ability to transmit the virus. What we know of the original variant is that the youngest children were really there was very limited possibilities of transmission of the virus and very limited effect of the virus on the youngest of children. It got more challenging the older children and young people became. What we don't yet have enough clinical clarity about is what's the effect of the new variant on children and young people, and particularly on older young people, if I can use that terminology, for 16 to 18-year-olds, for example. So we need to look at all of that data, and obviously, as we do that, we'll be trying to give as much notice as we possibly can do, but we may see changes in that data that give us more encouragement that could say to us that there may be the ability to move in a faster time period. But we will be trying to give as much certainty and as much clarity as we can in a situation where it is difficult to predict exactly the twists and turns of the virus and the effect it may have within our society. But I give the assurance today that I'm working on the basis that I want to give the maximum amount of notice to teachers and to parents and to young people of any changes to the arrangements that we have in place. Arrangements, I might add, which I think are working very well in general across the country today. Can we move on now to Christine Lavelle of The Sun? Christine.
Thank you. It was actually just following on from Tom's question there. You said yesterday that it's very unlikely the youngest children are transmitting the virus. Is there a case then that an argument that these pupils may not have needed to be kept off school at all? And if it's the case that they're not spreading the virus, why are they going to be off for at least another month? Also, just to clarify, when you say the youngest pupils, what exactly do you mean? Is it P1 to P3, for example, or do you mean the under 11s as sort of previous rules and guidance have applied to?
Okay, Christine, a couple of points in there. The first is that although on the information that we know, the youngest children are less likely to be involved in significant transmission of the virus and are unlikely to be significantly affected by the virus. Now, that's what we know so far. We don't yet know if that's the same position in relation to the new variant, but I'm expecting to get further clinical advice on that question. Now, the reason why children and young people are not all in school just now is not really to do with the degree to which they can transmit the virus, but it's generally to reduce the volume of human interaction within our society. If a child is going to early learning and childcare, they will be accompanied by adults to take them there. Each child will be accompanied by adults. There will be interaction to make that possible. There may be a need to use public transport. There may be a need to interact with other individuals. And the serious measures we've had to take have been to generally reduce human interaction within our society. So it's not just because of, so it's been about trying to make sure that we minimise the contact between individuals in our society so that we can support the messages which have been at the core of our steps since the turn of the year of that legal requirement now for people to stay at home. So that's been the purpose of it. So it's been completely justifiable to do that. And more than justifiable, it's been necessary to do that to make sure that we could reduce the prevalence of the virus. Now, in relation to your question about my use of terminology like the youngest of children, I'm talking there about children who will be in early learning and childcare. So that will relate to children who may be between the ages of 2 and 5. And essentially the youngest cohort of school-age primary school children of P1 to 3. So that's the grouping of what I would describe as the youngest children in our society. And as I've explained publicly before, that's one of the groups that we're looking at to see what role they might play in any phased return to face-to-face schooling that might be in place, because I'm mindful of the fact that those young people, those children, are, it's more difficult for them to engage in remote learning than it is for some other older children as a consequence. So that's the shape of the discussions that are going on within the Education Recovery Group just now. Can we move on now to Alistair Grant of the Herald?
Hello, sorry, it's actually Helen McCardle. I'm stepping in for Alistair today. That's all right. I just wanted to ask, with you saying that the R number is perhaps coming back to 1 and looking ahead to our exit from lockdown, one of the things that's been repeatedly raised by some experts, including people like David Schroeder, is the examples of places like New Zealand, Australia and Taiwan, which have used isolation hotels and quarantine hotels to improve compliance with self-isolation and quarantine. And I just wondered whether or not that was something that the Scottish Government is looking at all, or would consider, for a kind of post-lockdown phase to try and, keep numbers low and keep people complying with self-isolation more easily.
Thanks very much, Helen, and my apologies that my information wasn't up to date about your participation today. The short answer is yes. issues around isolation hotels and other arrangements are under active consideration just now by ministers and our advisors. I'll invite Jason to say just a little bit more about that.
So the fundamental answer is indeed yes, across the whole of the UK and frankly every country in the world, thinking about what a second wave exit looks like, particularly around the countries in Europe that have had this second wave, often with this new variant, which has changed the equation a little. It's not quite as simple as have quarantine hotels, yes or no. It's about importation of virus. So it's a broad set of measures, and you saw the UK governments take some of those measures on advice in the last few days about stopping travel corridors, about introducing pre-departure testing prior to coming to the United Kingdom as an additional layer, and so-called quarantine hotels would fit into a list of elements that we might consider, and we will have to. If we get over this second curve, then it will mean we have to look very seriously about the WHO's warning about importation of cases, because we have now imported the virus to this country on 2 occasions, in March and April, and then in June and July. And we will give advice to keep that to an absolute minimum once we get these numbers down, and we'll have to do that across the UK if we possibly can.
Okay, thanks very much, Jason. Can we move to Tom Martin of the Daily Express now? Tom.
Hi, good afternoon. Thank you, Deputy First Minister. Just returning to the issue of vaccine supplies. Last week at a technical briefing, we were told a number of health boards had opted to keep their supplies at this site in England due to issues around refrigeration, but it could be drawn down at any time it was needed. So I was just wondering, why do you think GPs feel they haven't been getting the supplies as needed? Is there some kind of bottleneck in the system that's been organised?
I don't think there's any bottleneck at all, Tom. We're essentially drawing down the vaccine on the basis of demand from within the health service to meet the particular groupings that are to be vaccinated as a priority. And we're doing that alongside the availability of the vaccine. Now, not all of the supplies that have been allocated to Scotland are yet available to Scotland, as we've set out on a number of occasions, including by the Health Secretary in Parliament. Quite a large proportion of the supplies that have been allocated to us will be available to us towards the end of January. Now, we're obviously getting close to the end of January, so more of that supply will be available for us to draw down and then to distribute around the system within the country. So I think our expectations about supply have to date been fulfilled. We expect to receive more substantial amounts of the vaccine in the weeks to come. Assuming that comes, we'll be able to distribute that around the networks, and then we'll be able to get the vaccine into people's arms, which is our absolute priority to do that at the earliest possible opportunity. Do you want to add to that?
I don't think there's a bottleneck. I think there's a complex supply chain that all 4 UK countries are managing, frankly, really quite well. Once the vaccine comes from the manufacturer, particularly Pfizer, to the main storage centre in England, it then isn't ready immediately to be distributed. It has to go through a number of further safety checks, batch checking, in order for it then to be released. Then we can order it. Once we do that, 24 hours, it arrives on our premises, just like around England, Wales and Northern Ireland. So it's an enormously complex process, and we have to judge it with getting to the people who then need it, whether they're in Orkney or Sauchiehall Street.
Thanks, Jason. Can we now move on to Simon Johnson of the Daily Telegraph? Simon.
Thank you, Deputy First Minister. I just wanted to follow up on vaccine supply again. I appreciate what Professor Leitch was saying earlier about you needing a management structure to sort of make sure that the vaccine supply is being ordered properly for the correct groups. But I think the BMA's point is we kind of have 2 management layers, because the doctors, the order from the health boards then place their orders with NHS national procurement, and NHS national procurement then go to the distributor. So their basic argument is you can strip out one of those management layers and still have a management layer that performs the function that Professor Leitch described earlier. Secondly, just on the numbers that have arrived, I was told last night that 600,000 were due to have arrived in Scotland as of this morning. Obviously, 334,000 have been put into people's arms. But it does seem slightly puzzling that GPs, and I was speaking to Andrew Bewis last night about this, they're still complaining about erratic supply, and some GPs haven't had their first delivery yet of the vaccine. So I suppose the question is, where are those other doses? Thank you.
Okay, I think on the question of management layers, there's essentially the decisions we've taken have been to put some structure into the way in which we order the vaccines and draw them down to create essentially fairness right across the whole country, so that we can make progress in all areas of the country in largely a reasonably consistent pattern. It won't be identical, but to give a bit of consistency and fairness across the country. Now, we've done that through health boards. We organise under health boards. In England, they use clinical commissioning groups as, I suppose, as gatherings of GP practices. But these clinical commissioning groups, the largest one covers 1.8 million people. Now, we don't have a health board in Scotland that covers 1.8 million people. The largest we've got is Greater Glasgow and Clyde that covers about 1 million people. And there's quite a number. There's 10 clinical commissioning groups in England that cover over 1 million people. So I think across the UK, we're all essentially working from GP practices at the local level into these, let me call them regional gatherings, and then into the wider supply chain. So it's a pretty similar outlook. Now, as part of what I said there about delivering fairness, we're obviously drawing down that vaccine across the country. That means, therefore, that there will be limitations over time about how much supply we can put in particular areas, because each of the vaccine comes in batches of 80 or 100. So if we were to give every practice in the country, let's say we're to give every practice in the country 100 doses, in each distribution, to do that evenly on every occasion, we'd have to be distributing 100,000 doses on each of those occasions. Now, we're getting doses in a variety of shapes and sizes coming down to us from the distributors, and then we're distributing them on around about the country. So it's, I understand completely that GPs want to be getting on with this, but we're trying to get the vaccine to them as quickly, as evenly, as fairly, and as consistently as we possibly can do. And as I said, I'm confident that providing we have the assurance about, providing we get the vaccines we've been assured that we're going to get, and I've no reason to suspect that won't be the case, but I noticed yesterday the factory producing the Oxford AstraZeneca vaccine had to be on alert about flooding dangers. So there are external things that can happen in life that can disrupt plans, that will happen, and we'll distribute it on to GPs. But as I said in one of my earlier answers, we continue to talk to GPs about how we can make this as smooth and orderly as possible, because we want to get the vaccine out as quickly as we possibly can do. Okay, if we could move on now to Gina Davidson of the Scotsman. Gina.
Hi, thanks very much, Deputy First Minister. A question probably to both of you. Yesterday it was reported that Professor Leitch had told civil servants that they shouldn't really book a summer holiday for this year, which I guess is not unexpected, but possibly even next year. And there was no saying when freedom of movement would kind of go back to normal. So I wondered what the government was doing in terms of supporting the travel industry long term, and what plans were in place for that, because that will obviously have been a bit of a blow for airports in particular to hear. And Professor Leitch also said that restrictions would be being eased very, very slowly, given how rates have gone up and down as things have happened over the last year. And I wondered if the government was developing a plan to look at, say, if you were to open schools for the youngest pupils, how long they would have to wait to see what the impact was of that before you would open it for the rest of pupils, and retail and so on and so forth. Thanks.
I think, Gina, your question raises quite a number of really difficult questions about the sequencing of opening up, and also about what opening up might look like and what it might feel like. I think if I've got a worry about the vaccination optimism, it's that people think once I'm vaccinated, somehow I don't have to follow lots of the constraints and the restrictions that are in place. We are going to have to require people to follow the basic rules, the wearing of face coverings, for some considerable time. How long is that? I don't know the answer to that question yet, but people are going to have to accept some limitations, even once we're all vaccinated, about how we can interact, because the virus will still be there and still a potential threat to us all. So there's a lot of care going to have to be taken, which is, I'll get Jason to just reflect on the comments that you're talking about from earlier in the week. But we're all going to have to take a pretty canny approach in the period going forward about how we plan and what we look out to. Now, obviously, there will be effects of that on different sectors of the economy. And what the government has tried to do over time is to look at the impact on individual sectors, take particular measures to support sectors where we can do, and to try to help sectors to get through what I accept is a really disruptive and damaging period to life as we know it. So I suppose my response to your question is that we'll all have to be pretty canny about what we do, even once we've been vaccinated, to make sure that we're exercising the maximum amount of caution. Jason.
Yeah, I did a question and answer session for Scotland's thousands of civil servants. The most important thing in that question and answer session was not what you reported today in your paper. It was a thank you to those civil servants who have kept this country moving in the last year and have worked round the clock to do so. I was asked loads and loads of questions, in that one of which was, what should we do about summer holidays? The exact same question I was asked here, I think, a week ago, and I gave the same answer. I said, don't book a non-refundable summer holiday because we just don't know what the world is going to look like. And I also said, I don't know what the world will look like in the 6 months following that into autumn and Christmas. I didn't say anything about 2022. I said this year is very, very unpredictable, and that's absolutely true. Vaccination optimism is one element of that, but there's also, remember, global vaccination. So will you be able to travel to a country that has struggled with vaccination rollout? We simply do not know the answer to that. And the second thing I was asked was, how will we get out of this? And I said it would be slow. I said it would be gradual, and we would have to think very carefully in our advice to ministers about what could open when. And schools and the well-being of children will, of course, be the priority in that opening. I also mentioned places of worship, which I also think should be a priority in that early opening. But whatever we do, with the new variant, with lessons from the summer, it will have to be gradual.
Thanks, Jason. Can we move on now to Paul Malik of the Courier? Paul. You there, Paul?
Hi, sorry, Deputy First Minister. My question is in relation to a letter that was sent out by the Office for Statistics Regulation yesterday, calling on those who are providing information on vaccines for breakdowns on characteristics like age group, sex, ethnic group, the number of percentage of vaccinations offered, administered or declined, where these vaccines have been given, and also the cohort denominators, a percentage uptake by a Joint Committee on Vaccination and Immunisation, or GCVI priority group. Basically just a fuller breakdown of statistics on who's getting the jab, when, and where they're from, so that we can understand what the vaccines are being, sort of the end goal of the vaccine programme is to be. And with that in mind, given that this was a similar sort of information that was being asked for around testing around the start of the outbreak this time last year, or in March, I'm just wondering why that hasn't already been provided.
Okay, thanks, Paul. I'll get Jason to go through quite a lot of to go through the detail on this, but we are publishing information on a daily basis about the number of people being vaccinated. I've just given that data for today. 334,871 people have had their first dose of the vaccine, which is really encouraging of the increase in pace that is going on. I'm struck by the fact that on the latest data from Public Health Scotland, up to the 17th of January, there were 240,487 people vaccinated. So in 3 days, we've vaccinated 94,384 people, which is a really good increase in the tempo of vaccination. So we published that detail. Obviously, we're working through a limited number of categories just now. We're going through care home staff and residents, health and social care workers and over 80s. Obviously, as time goes on, there'll be other categories that will be dealt with, and we'll no doubt look further at the statistics to be published. But Jason, can you go through
we
the
got
detail?
the information from the statistics regulator yesterday, like the other 4 countries did. They have an aspiration, I think I would call it, for very detailed analysis of the vaccination data. But burden of data collection is a real thing, though. It takes longer to vaccinate if you have to collect more data. It's just as straightforward as that. Now, some of the data we do collect, of course, and we publish that weekly now with Public Health Scotland, and the First Minister has given a commitment to look at the frequency of that publication, and if we can do it more often, we will. We also now publish daily vaccination numbers, but the statistical regulator is taken very seriously by our chief statistician and our analysts, and we will look to provide as much of that data as we can without slowing down the vaccination programme. Because if you use a nurse to collect data, you may not be able to use that nurse to vaccinate.
Thanks. Jason, could I now move to Michael Blackley of the Daily Mail? Michael.
Thank you. Good afternoon. This morning, the Scottish Government published a press release which said that 1,100 community vaccination centres are operational. Can you just clarify that figure? Because I think yesterday the First Minister said that 75% of GP practices have supply or are in the process of getting supply. So can you just confirm, of the 1,100 community centres, which I think 750 are GP practices, how many of them currently have supplies and are currently vaccinating people? And also, if I could just check on schools as well. You said yesterday that the R number would increase by 0.2 if schools were fully open. Today, you've said that even after nearly a month of full lockdown, effective full lockdown, the R number is still not actually below 1. Would it need to go considerably below 1 for schools to fully open? And if that's the case, should some of the parents that pupils aren't going to be prioritised, for example, the latter years of primary and the early years of secondary, should they anticipate a potentially very lengthy period of time away from school?
Okay, on the, I might come to Jason on the data about GP practices, but I don't think we'll have more data to update what the First Minister said in Parliament yesterday. On the issue of the R number, obviously, the analysis shows that when schools are operational, they contribute, because of the activity that's going on, to the R number. Where we get the R number reduced, it opens up the possibility of us enabling more children and young people to be back at school. Of course, there are some children and young people are at school just now because they're entitled to be there through the arrangements that we've put in place with our local authority partners. So obviously, we will be looking to try to use as much headroom as we possibly can do, given the fact that the resumption of full-time schooling is the absolute priority of of face-to-face schooling is the absolute priority of the government. And that will have a very high priority in the decision-making that we are able to take once the levels of the virus have reduced safely to enable that to be the case. Jason.
A couple of things on the R number, then the GP practice numbers. The R number is slow. It's always slow. That's how it works. The virus has a 10 to 14-day incubation period. So we've been fully locked down for 3 weeks, and we've been semi-locked down for 4. That's not even 2 incubation periods of the virus. So that's why we need to stick with it. It took 8 to 10 weeks in lockdown number 1 to get to the levels where we were reporting single figures. Now that would be a complete joy, of course, now, and we'll have to make decisions before we reach that point. But it's important that people hold their nerve. The R number takes a long time to fall, and then the R number then, of course, influences the prevalence in the hospital admissions. So I've got nothing particularly to add to what the First Minister said yesterday. We have 1,100 available places where vaccine will be given, ranging from the Louisa Jordan, which can do 4,000 or 5,000 in a day, as you saw on Saturday, to tiny GP practices in Barra or in other islands that have very small numbers of over 80s, and we have to work hard about the logistics of getting them to there. Vaccine will be available for all of them to get all the over 80s done within the timescale we've said, and then the over 75s. People will just have to be a little bit more patient. My own parents were impatient, and they were vaccinated yesterday in North Lanarkshire, but they were concerned last week why they hadn't had their call or their letter, and we will get to everybody who hasn't had that call or letter within the next few days.
Okay, thanks. And the last question is Mark McLaughlin from The Times. Mark.
Good afternoon. Technical number crunching for Jason, and then a political question for yourself, Deputy First Minister. Jason, we hear a lot about the differences between Scotland and England, and some of the things that we hear is the reason that Scotland is a bit behind is because of the administrative makeup of health boards, or maybe it's population density or population size. But we now have a breakdown of UK regions, and I can see that just across the border in the northeast, they have vaccinated 9% of their population. That population is about 50% bigger than Scotland. So I was wondering why they could vaccinate almost double. But on the flip side, London is at the bottom of the list. They've done just over 5%, which is a little bit behind Scotland. That's the most densely populated part of the UK. So population density, administration of health boards doesn't seem to answer that question. So simple question is, why is 9% of the northeast vaccinated, but only just under 6% of Scotland? And for you, Deputy First Minister, on this whole issue of transparency, has the Scottish Government spoken to Pfizer and AstraZeneca and asked for confirmation that they asked you to censor your vaccination schedule, or are you just taking the UK Government's word for that? And does it not seem a bit churlish if Pfizer and AstraZeneca have said, if you ask too many questions, we'll just go elsewhere?
Okay, thanks. I'll get Jason to answer the first question on the relative position.
So I can add a little bit to the second one as well, and it's simply that the Cabinet Secretary for Health has spoken to both companies in the last few days. The first question I would ask about your data, Mark, and I can do this offline, is how many care home residents has the North East vaccinated? So I actually don't think it's an administrative or a distribution problem that shows those differences between London and the North East, or the North East and us. I think it's about order of vaccination. So we have done well over 90% of our care homes, and the English average is 40, I think, or maybe 50 by now. But they have done more over 80s than us in the most recent data I've seen across the 60 million compared to our 5 million people. But we are headed in the next 2 to 3 weeks to meet at the end of that first set of priorities. And then we will do the same in the next 2 weeks as we meet at the end of that next set of priorities. So I actually think, and I'm not being flippant, I actually think the differences between the vaccination programmes North and South and Wales and Northern Ireland have been overemphasised. I think there are differences in order and logistics, but actually fundamentally they're pretty much all going as well as each other, with some minor differences in between them.
Okay, thanks, Jason. Just a couple of comments from me in relation to Mark's question. Yes, the Health Secretary has spoken to both Pfizer and Oxford AstraZeneca, and we accept the issues around about the limitations about the availability of data. We're trying to be as open as we possibly can do. I'm sharing with you data that, as of today, 334,871 people have been vaccinated with their first dose in Scotland. In the last 3 days, 94,384 people have had their first dose of the vaccine. That's a really good indication of progress. From last Monday to the Monday before, there was an over 50% increase in the number of people vaccinated in Scotland over the space of that week. So we're trying to put out as much data, but what I would simply say is a word of reassurance to members of the public that are watching this. The government is absolutely devoted to making sure that we get the vaccine out as quickly as we possibly can do to as many people in the order that has been suggested to us and recommended to us by the Joint Committee, because that is the best way of protecting the most vulnerable in our society. And we've made superb progress in our care homes, where we all know that residents are at their most vulnerable, and over 90% of care home residents have had their vaccination, their first dose already. That's been a huge physical commitment by our staff and by healthcare workers and by care homes, the length and breadth of the country. And most reassuringly for all of us, it's giving the most vulnerable in our society the protection to which they are entitled. And we're going to do that as quick as we can for absolutely everybody else. So thank you very much for your questions today and for observing the briefing that we've had today. My thanks to Rachel, our BSL interpreter, for her assistance today. Can I just remind everybody of the importance of following all of the rules that are in place? Fundamentally, please stay at home, please work from home and follow the rules, wear face coverings, avoid anywhere that's busy, clean your hands and surfaces, keep 2 metres distancing and self-isolate and book a test if you have symptoms. And above all else, look after each other and stay safe. Thank you very much.